Guillain-Barré Syndrome is a rare disorder in which the body's immune system attacks nerves, your own body damaging your own nerves. Strange disease. The first symptoms are usually tingling and weakness in the arms and legs. And these sensations can quickly spread, eventually paralyzing your whole body. So most people with Guillain-Barré need to be hospitalized for supportive care.
The exact cause of Guillain-Barré syndrome is unknown, but it is often preceded by an infectious illness, such as a respiratory infection or the stomach flu. And here to discuss is Mayo Clinic neurologist Dr. James Dyck. Welcome to the program, Dr. Dyck. It's nice to meet you.
Thank you very much.
Dr. Dyck, good to have you on the program. This has to be one of the more interesting, intriguing diseases out there.
Yeah, no, I think neuropathies in general are very intriguing, and Guillain-Barré is absolutely one of the more intriguing of them.
Neuropathy?
So, neuropathy means disease of the peripheral nerve. So it's damage to peripheral nerves, and Guillain-Barré syndrome is an inflammatory peripheral neuropathy.
Meaning it's caused by inflammation?
Meaning it's caused by inflammation and autoimmune causes, an attack by your immune system, as you mentioned. So Guillain-Barré syndrome is an example of that. CIDP, chronic inflammatory demyelinating polyneuropathy, is an example of that. And necrotizing vasculitis is an example of that. All of those things cause inflammatory neuropathies.
But one of the things about Guillain-Barré is that we don't know why.
I have this conversation frequently with patients.
Right.
From my perspective, we know why. And so I'll say to patients, your immune system's attacking your nerves. That is the mechanism of damage to your body. You know, we know why. This is what's happening. And they'll say, yes, but why does that happen?
Right.
And so what triggers that, how that happens, we don't really know that. You're right. There is this concept of molecular mimicry, meaning that there are things in the nerves that look a bit like the infectious organisms, the viruses. And so your body is fooled, if you will. It's trying to fight off that bad infection, and this is why it's often a post-viral neuritis, that you get an infection, your body mounts an immune attack to that infection, and instead of just attacking the virus, it starts attacking its own nerves.
But the interesting thing is people recover from this. So does the body finally figure out that it's wrong?
It's a good question. So yes, so the body attacks its nerves for a while in Guillain-Barré syndrome. That immune mechanism gets turned off and people recover. That is in opposition to CIDP. So Guillain-Barré syndrome is AIDP, acute inflammatory demyelinating neuropathy, versus chronic inflammatory demyelinating neuropathy, where the immune mechanism does not get turned off, and those people continually need treatment for their neuropathy.
Is that like MS?
It is somewhat like MS, but it's in the peripheral nervous system. So MS is a central demyelinating condition. CIDP and Guillain-Barré syndrome are peripheral demyelinating conditions. Now, myelin is the insulation around nerve fibers.
Does anyone ever die of this? I mean, does everybody's body finally figure it out that this is the wrong thing to be doing and they get better? Everybody gets better?
No. We have gotten much better at looking after people, and you sort of mentioned this originally. A lot of the treatment for this is supportive care. So people may need to be intubated and put on respirators. They need to have aggressive physical therapy. And so people used to die of respiratory deaths, or they would get deep venous thrombosis and pulmonary emboli. And we've gotten much better, but it's still occasionally people will die of it.
Well, how do you know that's what they have? What are the symptoms, first of all?
So it was already very nicely said, but I'll say it again. You start with numbness, prickling and tingling, and then you often have ascending paralysis. You get weak, and it happens fairly quickly. So by definition, Guillain-Barré syndrome occurs over the course of a month or less. It often will occur over the course of a few days. In contrast, CIDP occurs at least 2 months, if not greater. So that's one way you differentiate these conditions. There often is an elevated spinal fluid protein, and then there are demyelinating changes on nerve conduction studies, EMG, tests in which you shock the nerves to see how they respond.
There can't be too many things that are more frightening to a patient, that their body is becoming paralyzed.
I think it's terrifying, and it is very dramatic sometimes. I mean, you'll see a person on occasion, who in the morning is fine, and by that afternoon is completely paralyzed and on a respirator. And that is very dramatic when that happens.
And how do you know for sure that's what it is, Guillain-Barré?
Again, knowing for sure is partly a clinical diagnosis, and then you have the tests that help you confirm that, which are the nerve conduction studies, the spinal fluid evaluation. There are other things that can mimic it. For instance, botulinum toxin can give you a paralytic illness, and other things can as well. So you do test to try to differentiate this and sort it out.
But the treatment, there is no specific treatment for this disease. It's supportive care because there is no kind of antibiotic or drug that you can give people to help them?
That's not entirely true. So both plasma exchange, where you remove the blood and you throw away the plasma, and within that plasma are all those nasty antibodies and things that your body is making to attack itself. And then you throw that away and you give them new protein is one way of treating it. Or alternatively, giving other people's immune system to the patient, IVIG, intravenous immunoglobulin, giving that extra protein from other patients often will suppress your own immune system's immune response. And both of these treatments have been shown to be effective treatments in Guillain-Barré syndrome, meaning that patients recover faster than they would without them. But it's still largely supportive, as you say.
And most patients do recover fully, and how long does it normally take?
So it completely depends on the extent of their illness. So if they have a milder case, they'll recover more completely and more fully. If they have a very severe, very, very paralytic case, I've seen patients on a respirator for 6 months to a year and recovery taking several years. That is the very severe cases, and sometimes not complete recovery. Again, this is theoretically a demyelinating neuropathy, meaning it's the insulation. So if you re-insulate, you don't have to regrow fibers. But in some cases, you will actually get axonal loss where the nerve fibers themselves degenerate and they have to regrow. And in those cases, it may not be complete recovery.
Why is it when I'm getting my flu shot, do they ask if I've had Guillain-Barré syndrome?
Yeah, I am a very obnoxious patient to the nurses who ask me this question, because I always engage them in conversation and ask them what is the evidence that a patient should not have a flu vaccine, and they never can give me an answer to that. I don't like that question personally, and I don't think there is good evidence to that effect. Patients ask me all the time who have neuropathy already, should I have a flu shot? And I give them a very non-satisfactory answer, which is, if you are a patient who tends to get the flu, I would get a flu shot. If you're a person who never gets the flu, well, maybe you don't want to get the flu shot. And my thinking is this: there is evidence that you will get a post-viral neuritis like Guillain-Barré syndrome after having the flu. After having a flu shot, the evidence isn't quite as good. You're not really getting an infection, you're getting some of the proteins of that virus, so you probably have a less chance of getting Guillain-Barré syndrome. And your safest thing is not to get the flu and not to get the flu shot. But of course, you don't know if you're going to get the flu. So at the end of the day, I think it's a very personal decision. But so if you're a person who had a flu shot, after the flu shot developed Guillain-Barré syndrome, you probably don't want to get other flu shots. But by and large, I think most patients, given everything, it's better to get a flu shot. I get a flu shot every year, and I advise patients, you probably should have a flu shot. But it's not a straightforward thing, and I don't really find that question that they give to you very helpful.
One final question. Once is bad enough, but you can actually get Guillain-Barré more than once, can't you?
You can absolutely have recurrent Guillain-Barré.
Are you more likely to get it a second time once you've had it once?
Yeah, you're probably more likely than the average population. It's still, for most people, they're not getting it recurrently. However, I've seen people who have had multiple attacks, and I think those people are then at risk to develop more.
All right, everything you always wanted to know about Guillain-Barré, and hopefully you never get it. We've been talking with Mayo Clinic neurologist, Dr. James Dyck. Dr. Dyck, thanks so much for being with us.
Thank you for inviting me.